One of the characters that you must understand and determine is the character that describes the approach the physician or surgeon took to get to the intended anatomical site or organ upon which the procedure is going to be performed. Let's review your options. The medical surgical section, the first and the largest section in your ICD-10 PCS, has a large list of options that you get to identify with and then report. The first is an open approach, and this is the traditional make an incision into the body so that the body can be opened and the physician or surgeon can visually, with the naked eye, take a look at the organ. That's what we are using to describe an open approach, or, as I said, a traditional approach. Percutaneous also goes through the skin, but not with a large incision, a minor incision, usually no more than about 1 inch long, or possibly a puncture. So when a percutaneous approach is used, the physician cannot see inside of the body. So this might be a needle aspiration, where you would notice in the procedure notes that it might say ultrasound was also used to guide the needle aspiration or the body. Percutaneous endoscopic, now we still have that puncture or 1 inch incision, but instead of the physician or surgeon not being able to see inside, they put an instrument through the little tiny hole and use that to look inside. An endoscope, which means endo means into and scope means to view. If you see a procedure is described as laparoscopic, that is percutaneous endoscopic with regard to ICD-10 PCS. I want to interrupt this discussion of the approaches to point you toward guideline B as in boy 5.2, which tells you how to report an approach if there are 2 approaches involved and documented. The next approach option we have is via natural or artificial opening, and this is becoming much more commonplace because natural openings into the body, which include the nose, the mouth, the ear, the vagina, the urethra, and the anus, when instrumentation can be used through a natural opening inside the body, there is no need for an incision, whether it's large or small, which means less damage to the patient and shorter healing time. Very important. An artificial opening is most often referring to a stoma, which is an opening into the body that has been surgically created. Via natural or artificial opening endoscopic is similar to percutaneous endoscopic, where not the naked eye, but an instrument, an endoscope, is used to look further into the body. So the most common via natural opening endoscopic procedure is a colonoscopy. That is exactly what via natural opening endoscopic is, as an example. Via natural or artificial opening with percutaneous endoscopic assistance, this is a 2-for-1. So, for example, one of the most common of these dual approach procedures is when a physician is inserting a feeding tube into a patient's stomach. And in these cases, they may use an endoscope that is placed into the patient's mouth, down their throat, to look internally into the stomach while they are puncturing from the outside to insert the feeding tube into the stomach. That's a good example of what would fit with this approach. And an external approach is something that is performed directly on the outside of the skin or mucous membrane. There is no entry inside of the body. Now, you don't have to worry about memorizing things, but you do need to become familiar with them. You don't have to memorize them because all of these approaches are written right there in your ICD-10 PCS codebook. So now let's continue through the rest of the ICD-10 PCS sections, and you will notice that while you may have a different variety of choices, they're all approaches that we've already covered that are also available in medical surgical. So you see here in obstetrics, it's the same or 6 of the same approaches with the same explanations and descriptions as we just went through for medical surgical. For placement, only an external approach is available to you. That makes the choice easy, doesn't it? Administration, again, we have 6 similar, just like medical surgical, that are available for you to use. Measurement and monitoring, again, the same 6. Osteopathic services only use external, no decision there. Other procedures section only give you 5 options, but again, they're all familiar to you because you use them in medical and surgical. Chiropractic services are only available on an external basis. And new technology has 4 options for you. Again, the same definitions as you learned for the medical surgical section. So if you have any questions, please ask your instructor. I promise you're not the only one with a question. And remember that right there in your ICD-10 PCS codebook, all of these descriptions are there.